You used to sleep through the night without thinking about it. Now you wake up at 1 a.m. to use the bathroom, then again at 3:30, sometimes a third time at 5 before the alarm. Each time the urgency is real, but the output is disappointing. A weak stream, a feeling like the bladder did not fully empty, and then the frustrating process of trying to fall back asleep, knowing the cycle will repeat in a few hours. You have not told anyone about this because it feels like a minor inconvenience, not a real problem. But it has been getting slowly worse over the past year or two. And the fatigue from broken sleep is starting to show in everything else. Your focus, your patience, your energy, your mood. This is not a hydration problem. This is not about drinking too much water before bed. Something is happening inside your body that affects nearly every man after 45, and ignoring it does not make it stop. It makes it progress. Now, the organ responsible is the prostate, a walnut-sized gland that sits directly below the bladder and wraps around the urethra, the tube that carries urine from the bladder out of the body. The prostate's job is to produce seminal fluid. In terms of urinary function, it is supposed to stay out of the way. But after 40, a process called benign prostatic hyperplasia, or BPH, begins in the vast majority of men. BPH is not cancer. It is a gradual, non-malignant enlargement of the prostate tissue. As the prostate grows, it presses inward on the urethra, narrowing the channel through which urine flows. The bladder has to work harder to push urine through the narrowed passage, which over time causes the bladder wall to thicken and become more irritable. An irritable bladder sends urgency signals more frequently, even when it is not full. This is why you feel like you need to go urgently, but produce very little when you get there. The sensation is real. The bladder is genuinely signaling, but the signal is being driven by mechanical compression from the prostate, not by actual fullness. BPH affects approximately 50% of men by age 50, and up to 80% by age 70. It is not a question of whether it will happen. It is a question of when and how fast. The rate of enlargement is influenced by hormones, specifically the balance between testosterone, DHT, and estrogen. DHT, dihydrotestosterone, is the primary hormonal driver of prostate growth. It is produced when the enzyme 5-alpha reductase converts testosterone into DHT. In the prostate, DHT binds to androgen receptors and stimulates cell proliferation. More DHT activity in the prostate means faster growth. This is the same hormone that drives hair loss on the scalp, which is why many men experience both thinning hair and prostate issues in the same decade. The underlying enzyme is the same, the target tissue is different. Understanding this connection is important because it means that interventions which reduce DHT activity for prostate health also tend to benefit hair retention, and vice versa. The hormonal system is not compartmentalized. What happens in the prostate is connected to what happens on the scalp, in the belly, and in the bloodstream. They are all branches of the same declining hormonal tree. Estrogen also plays a role that most men are unaware of. As testosterone declines after 40 and visceral fat increases, aromatase activity rises. Aromatase converts testosterone into estradiol, a form of estrogen. In the prostate, estrogen amplifies the growth-promoting effects of DHT. So the combination of lower testosterone, higher estrogen, and sustained DHT activity creates an environment where prostate enlargement accelerates. This is also why men with more abdominal fat tend to develop BPH symptoms earlier and more severely than lean men. The belly is not just a cosmetic issue, it is an endocrine organ producing estrogen that directly feeds prostate growth. The impact of nocturia on overall health is far more serious than most men realize. Each time you wake up to urinate, you interrupt a sleep cycle. The deepest phases of sleep, where growth hormone is released, tissue repair occurs, and cortisol resets for the next day, happen in unbroken 90-minute blocks. Waking up 2 or 3 times per night means you rarely complete a full deep sleep cycle. The result is chronically suppressed growth hormone, persistently elevated cortisol, impaired testosterone recovery, and accelerated aging across every system. The prostate problem is not just a bathroom inconvenience, it is a sleep destroyer, and the downstream effects of destroyed sleep touch every other health issue a man over 45 faces: weight gain, energy collapse, cognitive decline, and mood deterioration. Many men treat nocturia as a minor annoyance and never connect it to the fatigue, brain fog, and weight gain they are experiencing during the day. But the connection is direct and powerful. Fix the sleep disruption caused by the prostate, and multiple other symptoms begin to improve as collateral benefit. The prostate is the upstream problem. Everything else is downstream. This is why addressing prostate health early is critical. BPH is progressive. It does not reverse on its own, but it can be slowed and the symptoms can be meaningfully reduced with the right protocol. Saw palmetto extract is the most extensively studied natural compound for BPH. At 320 milligrams daily of a standardized extract containing 85 to 95% fatty acids, saw palmetto inhibits 5-alpha reductase activity, reducing the conversion of testosterone to DHT in the prostate. Multiple clinical trials have shown that saw palmetto reduces nocturia frequency, improves urinary flow rate, and decreases the sensation of incomplete emptying. It is not as aggressive as pharmaceutical 5-alpha reductase inhibitors like finasteride, but it carries far fewer side effects. Most men notice a reduction in nighttime urination frequency within 4 to 6 weeks of consistent use. Zinc plays a dual role. The prostate contains the highest concentration of zinc of any tissue in the body, and zinc levels in the prostate decline with age. Zinc inhibits 5-alpha reductase locally, meaning it reduces DHT production directly in the prostate tissue. Supplementing with 25 to 30 milligrams of zinc picolinate daily supports both prostate-specific DHT reduction and overall testosterone retention. Since zinc also slows aromatase activity systemically, do not exceed 40 milligrams daily long-term, as excess zinc depletes copper. Lycopene, the compound that gives tomatoes their red color, has been associated in multiple observational studies with reduced prostate size and lower risk of BPH progression. The mechanism appears to involve lycopene's antioxidant effect on prostate tissue, reducing the oxidative stress that contributes to cellular proliferation. Cooked tomatoes release significantly more bioavailable lycopene than raw ones. Tomato sauce, tomato paste, and cooked tomato dishes are more effective sources than fresh tomato slices. If dietary intake is inconsistent, lycopene supplements at 10 to 15 milligrams daily provide a measured dose. Combining lycopene with a fat source improves absorption, so taking it alongside a meal that contains olive oil or avocado is more effective than taking it on an empty stomach. The evidence for lycopene is not as strong as for saw palmetto or zinc, but as a low-risk addition to the protocol, it provides an extra layer of antioxidant protection for prostate tissue. Reducing visceral fat directly reduces the estrogen load that amplifies BPH. Every kilogram of visceral fat lost decreases aromatase activity, which lowers circulating estrogen, which removes one of the growth signals feeding prostate enlargement. The protocol for visceral fat reduction has been covered elsewhere, but the key components bear repeating in this context. Resistance training 3 to 4 times per week, eliminating or minimizing alcohol, finishing dinner 3 hours before bed, and managing cortisol through sleep optimization and magnesium supplementation. These are not separate health goals. They are all connected through the same hormonal network. Fluid management does not fix BPH, but it can reduce the symptom burden while the protocol takes effect. Reduce fluid intake in the last 2 hours before bed. Avoid caffeine and alcohol in the evening, as both are bladder irritants that increase urgency. Empty the bladder twice before lying down, a technique called double voiding. Urinate, wait 30 seconds, then try again. This helps ensure the bladder is as empty as possible before the sleep window begins. Elevating the legs for 20 to 30 minutes in the evening, before bed, can also help by allowing fluid that is pooled in the lower extremities during the day to redistribute and be processed by the kidneys before sleep, rather than during it. Many men find that this simple habit reduces nighttime urination by 1 full trip, which translates directly into 1 additional unbroken sleep cycle. Pelvic floor exercises, sometimes called Kegels, are not exclusively for women. The pelvic floor muscles in men support bladder control and urinary function. Strengthening them can improve the ability to fully empty the bladder and reduce the urgency signals that drive nocturia. The exercise is simple. Contract the muscles you would use to stop urination midstream, hold for 5 seconds, release for 5 seconds, repeat 10 times. Do this 3 times per day. Most men notice improvement in urinary control within 4 to 6 weeks of consistent practice. It requires no equipment, no gym, and no time beyond 2 minutes per session. If nocturia worsens despite consistent protocol application, or if you notice blood in urine, significant pain, or a sudden change in urinary patterns, a visit to a urologist for a PSA test and physical examination is the appropriate next step. PSA, prostate-specific antigen, is a blood marker that can indicate prostate enlargement, inflammation, or in some cases, early-stage prostate cancer. It is not a perfect test and can produce false positives, but combined with a physical exam and symptom history, it provides useful information. The protocol described here is for BPH, the benign enlargement that affects the vast majority of men. It is not a substitute for clinical evaluation when symptoms are severe or rapidly changing. The bathroom trips at 2 a.m. were never about drinking too much water. They were about an organ slowly growing in a hormonal environment that is feeding that growth. Now you know which organ, which hormones, and what to do about it. The sooner the protocol starts, the more effectively the progression slows. Waiting does not help. It only gives the prostate more time to grow in an environment that encourages it. And every night of broken sleep it causes is a night your body could not repair what everything else in this hormonal decline is damaging. The prostate is not the only problem, but it may be the one that is quietly making every other problem worse.